Hi, welcome to another edition of Bringing Hope to Alzheimer's. I'm Ann Fraser, and I'm sitting here with my friend Nick Bolton, and he is a personal trainer. And today we're going to talk about the topic of exercise and brain health. So welcome.
Thank you.
Thanks for coming.
That's good to be here.
So let's just talk a little bit. Let's just start right out of the gate and talk about, we all know exercise is important for us, right? And we know that it does the body good in so many ways, but let's focus in specifically on the brain. So talk to me a little bit about, because first tell everybody about your expertise, how long you've been a personal trainer, all those types of things, and then tell everybody a little bit more about the brain.
Sure. So yeah, I've been a personal trainer for about 25 years, worked across the board, different organizations and fitness startup companies, but all the time with we call them clients, but right. So a good variety, a good base of information in terms of experiences to pull on.
Okay.
And with our clients and with, general health and the population itself, we see that a lot of people, we struggle from the same things. The body will respond very similarly with different type of stresses, right, with exercise. Mm-hmm. So when it comes to things like cognitive decline or Alzheimer's or dementia, things like that, our bodies tend to respond really well when we put specific stresses on the body. Mm-hmm. Get the heart to respond, increase blood flow and circulation, which generates growth hormone and increases, new cell production, which is going to be important for all types of processes in the body, from building muscle to regenerating organs, essentially, to help them work more efficiently, in this case, the cognitive function or the brain. So when it comes to things like cognitive decline, exercise, and I know you're also aware of this, but healthy nutrition, things like that, they are amazingly beneficial for the body in helping retain memory, with depression, with fighting those kind of things, and really helping our bodies, our minds stay young.
Mm-hmm, mm-hmm. So when we're talking about the brain and we're talking about getting the heart rate going and so forth, I know what I've experienced, but I want to hear from you, from the professional. So people who just go out for just a little leisure walk, that is beneficial, true, but really getting blood flow to the brain. Talk to me more about that and why that's beneficial to really kind of get your heart rate up a little bit.
Yeah, you're right. Doing those different activities, gardening and walking and things like that can help with increasing blood flow, circulation. You're moving, right? So right. Sitting is the new smoking. If you're sitting down, that's a great way to prematurely age yourself. Mm-hmm. So doing those things is great, but having a systematic approach, something that's more strategic in driving the blood pressure up in a safe way and helping to, increase the blood flow through the whole body. It needs to be designed that way. Mm-hmm. So doing things specifically for strength training or cardiovascular, if it's anaerobic exercise, both can be really important. So that's the most efficient way to do it. It's the most kind of a concentrated approach. You really get the best benefits from that because it also continues to progress you forward. It's not just an activity that you do.
Right.
A lot of times if it comes to walking and you walk every day, that becomes your minimum level of activity. Your body doesn't respond as much from that same type of action versus if you were to progressively challenge your body in a safe way, that's going to help kind of keep that needle of progress forward so you can continue to make progress and progress. And in this case, you can continue to see the results from that rather than, you've heard that plateau effect, right? So you kind of level out. Like any exercise, again, you need to continue to challenge your body more and more for your body to respond and give you the benefits.
So are you talking more like HIIT training?
It can be, it all depends on the population and ultimately what their goals are. So HIIT training, being high intensity interval training, is good for a certain population. But generally, people that are going to be experiencing cognitive decline and Alzheimer's, dementia, and that sort of thing, that population, I generally wouldn't recommend HIIT training for. So, it would be more, it could be anything from, again, challenging yourself at different styles of cardio. Just, again, maybe if you like to walk, finding a hill to walk up, walking into the wind, things that can challenge you more than just walking on a sidewalk around in a neighborhood. So finding things that challenge you outside. Strength training, proper strength training, if you do it right, is also cardio in nature. You can get the benefits of cardio with the benefits of strength training in stimulating muscle as well as that blood flow and circulation. So there is some benefits there as well, and that could be tailored to that person lower intensity, weights that are appropriate, rest phases that are appropriate. So it's all based on that particular client, but you can get the benefits with strength training as well as with cardio. Now, most of the studies right now are more, aerobic in nature. So more just blood flow, right? Walking or, doing some other kind of cardio as well. So.
Yes. So I want to talk about both ends of the spectrum for a minute, because to your point, your older population, what we think of who gets Alzheimer's now. I want to throw out a statistic. So in the last 2 years, so pre-Alzheimer's, okay, that is now considered age 30 to 64. So anyone who gets diagnosed with cognitive decline or whatever, it can be considered pre-Alzheimer's or early onset. Okay, so somebody like me. So in that case, the statistic is in the last 2 years, the amount of people that have been diagnosed with early onset dementia has gone up 200% in the last 2 years. So what I like to talk about, of course, I think exercise, let's talk about both ends of the spectrum where you talked about the older clientele. And yes, they're not going to be doing HIIT training. They're not going to be doing, but let's talk about the younger clientele where I'm considered at this point. So the 30 to the 64 year olds, so I will tell you in my workout, just off of some of the things I've been reading, I do handstands. I'm trying to get as much blood flow to my brain as possible. And then I'll try to do, headstands where I tap my head on the floor and push. So I can't quite get all the way to the floor, but I'm working on it. But I'm doing a lot of things to try to get more blood flow to my brain, because that can be an issue for people who are experiencing cognitive decline. So what are some other things that if someone were to hire a trainer, or the advice you would give someone on that 30 to 64-year-old range, if they want to make sure that they're making their brain better?
So with the younger population, you can generally do things differently. It always comes back down to the client, what the client's capable of doing. Mm-hmm. If there's any limitations at the front end of that, where they may be, limited to doing certain movements,
sure,
previous injuries, things like that. So, but generally, if it's a healthy individual physically, you can challenge them as they need to be challenged. So each time a client walks in the door, you need to make sure you match that type of challenge to that client, what an appropriate challenge would be, and based on their goals. So if we're talking about blood flow and circulation, with exercise and specifically strength training, that will really elicit it will help improve the strength of the heart itself, which then can pump blood no matter what position you're in. Now with strength training, you can move positions based on if you're using certain devices. If it's dumbbells or a free weight, you need to move your body to, target different muscles because you have gravity.
Right.
But generally speaking, you can do more intense movements with that. Strength training is going to be, again, where I typically would gravitate more towards, because you get the other benefits along with, just blood flow. You get the increased blood flow, but it stays increased even after the exercise is over, whereas aerobic exercise is going to be pretty much limited to when you're finished with the activity, your blood pressure, your blood rate reduces into recovery phase quickly. So you have benefits there, but I think that if you are capable, strength training is going to be a little bit more, it's going to be better suited for the benefits of, even the younger early onset, on Alzheimer's, things like that. So with that population, you can do a little bit more. I just tend to see more of the results, more of the benefits from strength training, because you can tailor that. You get the benefits of blood flow, even a interval style blood flow where you are challenging your body to recover. And then when you get the recovery phase, you challenge it again. It's a way of stressing your body, but letting it recover between. You get some really good benefits that way, again, in physical too.
Okay, I like that. Then let's go to the opposite end where someone's over 60, they're 65 and over. Even if they, like you had said, like walking into the wind or up a hill or whatever, and they can even do a little bit of interval in the fact they can walk slower and then walk a little bit quicker. What are some other things that they can potentially do? Because a lot of people can't always necessarily hire a trainer at that age, but maybe they can. So what would be some things that you would suggest? Yeah,
that's actually a good question. And the nice thing about that population is that they tend to still respond really well to exercise when it comes to the ability to improve cognitive ability, but also reduce that decline. So there's a really good response rate even as they get older. So people that are getting older, it's not too late to start with the exercise piece.
Right.
I think that's important. I know you've hit on that before, but it's important when you're younger, and it, in some cases, even more important as you get older, just to start. It can take around 6 months to really see some of those benefits start to happen in some studies. So it's important that you can start at any point. Now, if you are older, you don't have access, we'll even call it not even having access to a gym or equipment, doing things outside. If you like to do some hikes in some controlled environments, that's a good place to start. You can walk up and down staircases. You can sit down in a chair and stand up. You can do a lot of things that challenge your body over a period of time, and it doesn't have to be hour or longer workouts. It can be 20 minutes. It could be 30 minutes, even less. But just being able to move around and challenge yourself with the things you have around you is a good place to start.
Right.
Trainers, controlled environment, supervision, they can make sure you're moving biomechanically correctly so you can stay safe. So that's an advantage. But if people don't have the access to a trainer, you can certainly do things around the house. It's just moving, but again, moving repetitively.
Right.
So if it's doing, the squats, if you sit down in a chair, you stand up, you do that for 30 seconds. Then you can walk up and down the stairs for 30 seconds. So there's a lot of things you could do and then gradually improve on that or challenge you more next time. So.
Good. That's great. Do you have any clients or have you had any clients that have had cognitive decline?
I have. I have actually in my history, I've gone to their location and trained them. I've had clients that have had MS and cognitive decline, using a walker, and still had a lot of excess weight that they had to work through. So I just used their environment, used their house where they were living, and just use the stuff around us and their day-to-day activities, stuff that they would need to still be able to do, and just got them very efficient at doing those movements and then challenging them within those same movements. Already familiar with those. It was inside their comfort zone, so they were able to still, be comfortable with them moving around, but also challenge themselves as they got through it. So, yeah, we've had clients like that. And again, like you said, various levels of that. And you can also introduce things mental things like brain games, things that you can challenge them as well there to help that cognitive process too.
Right. That's excellent. Good. What else that we've not covered? What else would you like to say?
Yeah, I think that covers a lot. And every person is different. So when it comes to these type of, scenarios and people dealing with their, whatever they're dealing with at the time, their issues, knowing that you can start slow, ease your way into it. Yeah, I know it can be intimidating at first. But again, you just take it at your own pace and then just try to do a little bit more. There's just so many benefits to the exercise component, eating healthy and those things where, again, I mentioned this earlier, but not only just from the cognitive part of it, but also things like fighting depression, which can come hand in hand with that sort of thing.
Absolutely.
Well, I've talked to and worked with doctors that agree that can actually, the exercise component and the dopamine release is similar to that of even antidepressants, even to the moderate level of depression. So there's a lot of benefits from that, and especially from the mental aspect. And the physical, I think we know a lot about the physical. So you can accomplish a lot and cover a lot of ground. But as I tell people when they're getting into this thing, there's a couple things to keep in mind. The first thing you want to do is you want to ease into it. You want to start slow and gradually get into it. As you get more comfortable, you acclimate to the stress of exercise. But then being consistent with those things is really important. So doing the things, those type of things, daily or a couple times a week, but being consistent with that, and then sticking with it. So not giving up, but sticking with it. And when it comes to fitness goals, or if it is again something more cognitive related, you're going to reach those goals. You're going to get a lot closer if you do those three things. And again, it's just part of introducing that and adding that to your life. Right.
Very good. If people want to get a hold of you here in Kansas City, we have viewers from other states and other areas, but if people are in the Kansas City area and they're interested in getting a hold of you, how do they do that?
So they go through our website, nickboltonfitness.com. So they can go through that. They can send us a contact page through that, or they can email me at nick@nickboltonfitness.com. We do also have online or virtual training. So we do work with people in other states, countries. We can guide them along with workouts that are just designed for them based on the equipment they have. And we can also kind of keep them accountable. There's an interactive piece to that. So we can work with people that are just local, but we do have a large local presence, so it's easy for us to work with people of various goals.
Yeah.
But yeah, nickboltonfitness.com would be the best way to get information and to follow up with us.
Excellent. I appreciate you being here today.
My pleasure.
Thank you so much. So Nick does know a lot, as you can tell from just this session. He is super knowledgeable about so many things. If you do live in the Kansas City area, I would suggest looking him up. And we appreciate you tuning in today. Please make sure that you are always, if you're going to start an exercise program, make sure that you are talking with a professional and your doctor to make sure that you're ready to get going on that. And again, we appreciate you tuning in, and we'll look forward to seeing you next time. Thanks.